Hello, everyone. I'm Adjoa Kyerematen of the National Minority Quality Forum, and this is For Your Health News. Your health, your news, your power. And for this segment, we're going to be talking about demystifying clinical trials. We're going to be talking about maybe some misinformation and general myths you've been hearing about healthcare with the one and only medical Mythbuster, Dr. Joel Bervell. Joel, would you like to introduce yourself?
Yeah, hey everyone, my name is Dr. Joel Bervell. I'm an internal medicine resident. That basically means that if you're in the hospital and you're going to get treated, let's say you're having COPD, which is obstructive pulmonary disease, or an asthma attack, or something your stomach is hurting, I'll be the doctor that comes in and tries to figure out what's going on. We'll take your labs and try to make you healthy, get you out of the hospital. For the past few years, though, I've been using social media as well, so Instagram, TikTok, to talk about disparities in medicine. Why is it that in many different metrics, Black communities, unfortunately, are disproportionately more likely to, for example, get asthma or to be diagnosed with melanoma at later stages? So I really try and demystify these large topics, break them down in ways that our community can understand, so that when we go to the doctor's office, we have a little bit more information, we know more of the right questions to ask, so we feel like we're getting our health really listened to, and that we have the connections that we need to make sure that our families and ourselves are healthy.
One of the biggest issues right now, as you might know, is that only 5% of people of color, that's basically Black and brown folks mostly, are participating in what is called clinical trials. Now, say at the National Minority Quality Forum, you don't love the word trial because it can scare people, you know? But these clinical trials are very important clinical research programs that are the gateway to innovative medicine. It's the way a lot of people are getting access to medicines that they may not ordinarily do. Joel, what would you say is the greatest myth that you've heard around clinical trials?
I think a lot of times people don't realize that medication that we receive, we don't just get it, right? It has to go through a process where it's tested in different ways to make sure that it's actually going to be healthy and not going to harm us more than hurt us. I think one of the biggest myths I've heard out there is that medications aren't actually looked at or researched in a way to make sure that they don't harm our own bodies. And so I really always try to make sure to talk to people about what the clinical trial, clinical research pipeline looks like. That looks like actually getting a medication. Oftentimes, these are medications that were used from natural remedies already that people were using, that we found out there was properties that could work for our bodies, that we start using them. And so it's a trial that undergoes first testing in the basic laboratory setting, testing that on animal models before it even gets to the human trials in the first place. And so it's a long process, and it's a process that is done in a way to make sure that it's totally safe for individuals. I think a lot of other people don't know that clinical trials, you only know about them if you ask about them. Unfortunately, most people don't understand to ask their doctors, is there a clinical trial that's right for me? So let's say that you have breast cancer. The medications you've been giving aren't working, but there might be a new novel medication that could work for you, but because we're not asking the right questions of, could this medication work for me? We don't even realize that we have to go out and figure out what other options are there for me.
Yes, and I also want to remind those who are watching on the live stream. Apparently, we have 6,000 people watching on our live stream right now. If you have questions, please put the comments in the chat, and we'll forward them to Dr. Joel Bervell. Now, you talk about the fact that it's a long process, that has a lot of steps and a lot of standards to reach, right? What would you say has been the biggest misunderstandings around maybe safety procedures or safeguards that are in place for clinical trials?
Yeah, I'd say that there's multiple different safeguards. There's different phases. Each phase tested in different groups, different individuals. I will say, unfortunately, for a long time, we actually weren't testing it in specific population groups. So it wasn't until the late 1990s that we actually tested on women medications. And that's unfortunate because that means medications could have been working differently for different populations without knowing it. Thankfully, that's been corrected now. And so now when we test different medications, we make sure that it's done on all different populations, all different ethnic groups, people from different areas to understand how is it going to work in different people. Because we're all different no matter where we're from, even within racial groups. There's actually more diversity within racial groups than there are between them. That matters because the more individuals we're able to get to actually be able to have these conversations, be able to be getting these clinical trials that can be making us better. That's how we actually get access to it. And oftentimes, these clinical trials are going to other communities that are affluent or wealthy, because they know to ask these questions and know that the medication could work for them, but that process takes a while for it to get on the market for everyone else.
We're going to talk about how folks should be asking questions of their doctor in a second. But you mentioned the past. So let's talk about Tuskegee, if you may, because everybody here knows about the Tuskegee experiment, right? Okay. What do you say is probably the biggest misconceptions about the Tuskegee? What's the biggest misinformation that you might have heard around Tuskegee?
So Tuskegee obviously was one of the most horrific acts in the United States when it came to clinical trials. For those who don't know, what happened was in Macomb, Alabama, they basically had a cure for syphilis. The cure was penicillin, but they didn't give that cure to individuals that were part of the study, even though halfway through we found out about that cure. And so it was an example of withholding medical treatment that could have been good for these populations. What a lot of people don't know, though, is that a lot of the safety standards that we have today came out of that. So one, informed consent. Have people heard about that? What informed consent is? So let's say you're getting a procedure, or you're taking a medication, or you're joining a clinical trial. We have this process of informed consent where we walk you through the risks, the benefits, all the things that can be happening to you. That came out of the Tuskegee trial happening. There's also been increased standards when it comes to patient safety and protected patient information. And so those were all things that came out of the unfortunate tragedies that happened. So I think the biggest misunderstanding is that, yes, that occurred, but what we tried to do was figure out why there were gaps there and then try to fix it. That's not to say that they're not still there. I think it means that we have to be aware and ask the right questions. But thankfully, some of the standards that caused and allowed for these syphilis experiments to happen have been taken away.
Yes, thank you so much for that clarification. So let's talk about the fact that, oftentimes you don't hear about clinical, what I like to say, research programs or clinical advancement programs, because really it's about access to the most groundbreaking medicines you've ever heard of. How should these folks be navigating the conversation with doctors just to ask about information regarding clinical trials?
I think simply one of the first questions you ask is, do you know any clinical trials for my specific condition? Starting it there. And if the doctor says no, it can be a mutual conversation at that point. It can be is that something we're able to look into, or do you have colleagues that may know about these clinical research and advancement programs that may be happening? One thing I often say is in medical school, we don't learn about clinical research very much. We don't learn about how to actually talk to patients about it, or even how to do the research ourselves. That means it has to be a mutual thing between patients and their providers, where we're learning together. I think doctors can help guide you to the right spaces to say, here's a trusted resource, here's one that should not be trusted. But at the end of the day, I always say that we have to be our own advocates, because we know what we're going through better than anyone else will ever. We know what it feels like. We know where it hurts. We know what needs to be fixed. And so when we talk to doctors, it needs to be a mutual conversation between the patient and the provider. We're really trying to figure out what are the goals we have, what research or medicines are out there that can get me to the end. And also understanding that not all things are created equal, that not all diseases are equal. I think even when we think about something like cancer is a collection of different diseases. So one clinical trial for breast cancer is very different from something for kidney cancer, and we can't kind of compare all the two. So it's all about really getting information and working on a personalized basis with your physician to be able to find the right resources for you.
You mentioned the fact that sometimes we have symptoms that we ignore. We don't talk about with our doctors. We are here at National Minority Quality Forum, particularly talking about access to lupus clinical trials. So if you haven't already stopped by at the Her Health Hub, please do that, because lupus is an autoimmune disease where sometimes we're just really tired. And we think that that's normal because we decided to normalize tiredness in our community. Or, we have hair loss, patches in our hair. We don't understand what that is. Or rashes, unexplainable rashes. Really, with anything that feels abnormal, we need to be having that conversation with our doctors, correct?
Yeah,
Yeah.
I think that's why you need a primary care physician. I think a lot of people don't have primary care physicians, or they use the ED or other resources just as needed. There's nothing wrong with having someone that you can go to consistently, and maybe once a year getting a checkup, right? Especially when we get older, there could be things that keep going on. So right now, as I mentioned, I'm an internal medicine resident, and when I see patients in primary care clinic, we have a little list of what we call care gaps. That could be that we need to check someone's PSA level for their prostate. That could be that maybe someone needs to get a mammogram, maybe someone needs to get a pap smear. But those are the things that we need to be staying up to date on. So one question that you should be encouraged to ask your doctor is, am I up to date on my care gaps right now? Are there things that I need to be doing, whether it's checking my liver enzyme levels, whether it's checking my glucose, whether it's checking my HbA1c, if I have diabetes? All these are questions that your doctor should be working with you on, but maybe they're missing it because they're seeing a lot of other patients. And so making sure you understand your condition is really important. And one thing I was going to say to your previous point of where can people go for resources, patient advocacy groups are incredible opportunities. So you just mentioned lupus. Lupus has a lot of groups online where if you go and find a patient advocacy group or a lupus national foundation, you'll actually be able to go online. They'll have clinical trials there. And they'll also have people that have done these clinical trials that you can actually talk to. And you can actually have a conversation. So that way it doesn't feel like it's separate out or that it's a doctor telling you something. It's a patient that has actually gotten a medication or gone through the research and is actually understanding it. And you then get a support system of other individuals who are having similar symptoms to you, maybe symptoms that you were ignoring before, that you were able to get checked. All that to say that yes, make sure you get symptoms checked out, but it should start preventatively, meaning that you need to get a primary care physician, you check in on, even if things feel normal, just so you can make sure that you're actually healthy all the time. That's how we get the best care.
I'm going to come to you guys for questions soon, so think of your questions right now. But to that point, I must say, if you check out beyondlupus.org, that's NMQF's lupus resource hub, which we are talking about clinical trial opportunities there as well. And we also have resources about our Beyond Lupus patient network. So it's folks like us, who are experiencing lupus right now. You can talk to your peers about it. Well, okay, Joel, you reach millions of people a day. Okay, millions. If you don't know about him, get to that. What are some of the interesting questions that you can think of that you have found that have really been enlightening to you regarding just the level of misinformation that's out there regarding healthcare these days?
It's a good question. I don't know what the most common question I get is, but I think one that I often see that makes me think a lot about just like where is healthcare going is like how do I find a black doctor? And so I think a lot about the fact that in medicine there's unfortunately less than 6% of all doctors in healthcare that are black. A lot of people are often saying, how can I find someone who looks like me, or is from my community, or understands my needs that I can reference, that I can go to, and actually get care from? There's websites online that people can access, so I think that's one place that individuals can go. The second question I get is usually for the kids. And it's like, how do I get my kids to also be a doctor? I'm all about representation. I've always said that you can't be what you can't see. And we need more representation in medicine overall. Like I said at the beginning, 6% of all doctors are black. So I've been trying to do things like I started an animated digital kids TV show called The Doctor Is In. Check it out on YouTube if you have kids, where you can watch it with your kids. It's a co-viewing show where we talk about really basic science concepts like asthma, and heart disease. And it's really interesting because I've already had parents reach out and say, my kid loves watching this, so when's the next episode coming? Simply because they were able to see themselves represented on a screen where they weren't able to before. So I think really the most common questions I get are about how do I make sure I'm finding the right doctor for me, and then two, if I want my future son, my son or my daughter to become a doctor as well, or be in the healthcare field, what are the resources I need to go to?
And when is the next episode coming?
That's a good question. Episode 1 is now out. We launched it last week. It's an animated show. We have Little Leland. I think the next one will come out next month, probably. But there's also other modules online that you can do with your kids, from things like making a paper bag model of lungs to making a paper spine out of cardboard boxes. So lots of different things that you can do with your kids.
Okay, the doctor is in, and he's in right here.
It's really about taking action, right? That's a big takeaway. Dr. Joel has taken action in his own life. He shared his story. All of us have our stories. One thing I'll be remiss to not mention is with this concept of, access to life-saving research, that we can all be community scientists, okay? Just wanted to let you know, NMQF, we have our Community Health Biobank. It's a national clinical research program to investigate the fact that why are we so susceptible to all of these diseases? Why are we experiencing disproportionate rates? And so the only way we can get those answers is if we participate. Just a swab of our cheek, a little drop of blood, and then we are building this research together. All of you as community scientists can be like Dr. Joel Bervell here. I want to thank you so much for your time today. I think he might have a few minutes when he leaves here if you have additional questions, but I want to thank you guys so much.
Thanks for being here.